Question 1. Advanced animal behavior and communication. A veterinarian refers a highly anxious rescue dog Max to you for behavior modification. Max exhibits fear-based aggression, especially around unfamiliar men. You must develop a behavior modification plan for Max. Which of the following techniques is the most appropriate and ethically sound approach? A. Use positive punishment, e.g., startling Max with a loud noise to stop aggressive behavior immediately. B. Apply counter-conditioning by pairing the presence of unfamiliar men with high-value treats in a controlled environment. C. Use negative reinforcement by withholding food or attention until Max stops displaying fear-based aggression. D. Physically restrain Max until he becomes desensitized to unfamiliar men. Answer. B. Apply counter-conditioning by pairing the presence of unfamiliar men with high-value treats in a controlled environment. Explanation. Option B is correct because counter-conditioning involves changing Max's emotional response to a trigger unfamiliar men by associating it with something positive, treats. This method aligns with the principles of animal behavior science and avoids causing further stress. Option is incorrect because positive punishment can increase anxiety and worsen aggression, violating ethical guidelines. Option C is incorrect as negative reinforcement may confuse Max and fail to address the root cause of his fear. Option D is incorrect because physical restraint can escalate fear and aggression, making it unethical and counterproductive. This approach complies with guidelines such as the AVSAD position statement on humane behavior modification. Question 2. Scenario-based client communication and education MS. Carter brings in her cat Luna for a checkup. Luna's obese and has started to develop mobility issues. MS. Carter admits she has been overfeeding Luna because she feels guilty when Luna meows for more food. As an animal care provider, how should you educate MS? Carter to address Luna's obesity and prevent further health complications. A. Recommend reducing Luna's meal portions gradually and switching to veterinarian-approved weight management diet. B. Suggest ignoring Luna's begging behavior entirely to discourage her from associating meowing with food. C. Advise MS. Carter to allow Luna free feeding access to encourage natural self-regulation of her diet. D. Recommend Luna receive treats regularly, but only if she performs desired behavior, like sitting. Answer. A. Recommend reducing Luna's meal portions gradually and switching to veterinarian-approved weight management diet. Explanation. Option is correct because gradual dietary changes and weight management plan are essential for safely addressing obesity. This approach ensures Luna's nutritional needs are met while reducing caloric intake to promote weight loss. Option B is incorrect as ignoring Luna's behavior without providing alternative enrichment or addressing hunger signals may lead to frustration or behavioral issues. Option C is incorrect because free feeding often exacerbates obesity, especially in cats who lack natural dietary regulation. Option D is incorrect as giving regular treats can undermine the weight management plan. Treats, if given, should be limited and accounted for in the overall caloric intake. This advice aligns with guidelines from the Association for Pet Obesity Prevention. Question 3. Record keeping and documentation. During an annual inspection, a regulatory body requests to review your facility's animal care records. What is the primary reason accurate and detailed documentation is required in an animal care setting? A. To meet legal requirements and provide evidence of care quality during audits or inspections. B. To simplify daily tasks by reducing the need for direct communication with colleagues. C. To eliminate the risk of client misunderstandings or disputes about care recommendations. D. To reduce the workload associated with providing care plans for animals under your supervision. Answer. A. To meet legal requirements and provide evidence of care quality during audits or inspections. Explanation. Option is correct because accurate records are a critical requirement under animal welfare laws. They provide documentation of care plans, treatments, and compliance with ethical and legal standards. Option B is incorrect as documentation is meant to complement communication, not replace it. Collaboration is essential in animal care settings. Option C is incorrect because while records can clarify disputes, this is a secondary benefit rather than the primary purpose of record keeping. Option D is incorrect because maintaining records adds to the workload but ensures accountability and quality of care. This is consistent with the Animal Welfare Act and industry best practices for maintaining transparency and accountability in animal care facilities. Question 4. Animal health and wellness. You are working in an animal care facility, and a dog named Bella is brought in for a routine checkup. Bella's owner reports that she has recently been lethargic and has reduced appetite. After thorough examination, you notice Bella has fever and her lymph nodes are swollen. Which of the following is the most appropriate course of action for Bella's care? A. Immediately administer broad-spectrum antibiotic and send Bella home with instructions for rest. B. Recommend blood test and cultures to identify any underlying infection and potentially delay antibiotic treatment. C. Suggest Bella undergo surgery to remove the swollen lymph nodes immediately. D. Give Bella an anti-inflammatory medication and monitor her condition for a few days. Answer: B. Recommend a blood test and cultures to identify any underlying infection and potentially delay antibiotic treatment. Explanation: Option B is correct because a thorough diagnostic approach is crucial before administering antibiotics. Blood tests and cultures will help identify the underlying cause of Bella's symptoms, ensuring the correct treatment. Option is incorrect because administering antibiotics without identifying the source of infection could contribute to antibiotic resistance and may not address the true cause. Option C is incorrect as surgery to remove lymph nodes is not typically indicated without first determining the cause of swelling. Option D is incorrect because administering anti-inflammatory medication without addressing the underlying cause may mask symptoms, delaying proper diagnosis and treatment. The approach follows guidelines on proper diagnostic procedures in veterinary care. Question 5. Specialized care. You are treating a geriatric cat named Whiskers who has recently been diagnosed with arthritis. Whiskers is showing signs of pain and stiffness, especially after periods of inactivity. Which of the following treatments should be included in Whiskers' care plan to manage her condition effectively? A. Prescribe pain relief medication and advise Whiskers' owner to limit her physical activity to avoid strain. B. Recommend weight reduction program, as obesity can exacerbate arthritis and provide joint supplements for support. C. Advise Whiskers to stay on strict diet of soft foods to prevent any further discomfort while eating. D. Suggest placing Whiskers in warm, confined space to limit her movement and reduce joint stress. Answer: B. Recommend a weight reduction program, as obesity can exacerbate arthritis and provide joint supplements for support. Explanation: Option B is correct because obesity significantly exacerbates arthritis in older cats. The weight reduction program, alongside joint supplements like glucosamine, helps alleviate pressure on the joints and can improve mobility. Option is incorrect because while pain relief is necessary, limiting physical activity entirely can worsen stiffness and muscle atrophy, potentially leading to more joint issues. Option C is incorrect because the focus should be on managing arthritis through joint care and weight management, not altering the diet to soft foods unless there's a specific dental issue. Option D is incorrect as confinement and limited movement may contribute to the loss of muscle strength and worsen mobility problems. Controlled exercise is important for joint health. These treatment approaches align with the guidelines provided by veterinary, orthopedic, and geriatric care experts. Question 6. Animal nutrition. A dog named Toby is diagnosed with food allergies, presenting symptoms of itching, gastrointestinal distress, and ear infections. Toby's owner reports that he has been eating the same commercial dog food for the past 3 years. Which of the following is the best approach to identify and manage Toby's food allergies? A. Continue with the current diet and administer anti-inflammatory medications to control symptoms. B. Switch Toby to novel protein or hydrolyzed protein diet and initiate an elimination trial to identify the offending ingredient. C. Increase the amount of food Toby receives to reduce his sensitivity to allergens. D. Use probiotics and digestive enzymes to ease Toby's gastrointestinal distress without changing his diet. Answer: B. Switch Toby to a novel protein or hydrolyzed protein diet and initiate an elimination trial to identify the offending ingredient. Explanation: Option B is correct because an elimination diet using a novel protein or hydrolyzed protein is the gold standard for diagnosing food allergies. This method isolates potential allergens, allowing you to monitor Toby's response and identify the cause of his symptoms. Option is incorrect because continuing with the current diet could worsen the allergic reaction, and anti-inflammatory medications merely mask the symptoms without addressing the root cause. Option C is incorrect because increasing the food intake will not solve the problem and could worsen the allergic reactions, especially if the allergies are linked to specific ingredient in the current food. Option D is incorrect as probiotics and digestive enzymes are useful for gut health but do not address the underlying food allergy causing the symptoms. The approach aligns with veterinary guidelines for managing food allergies in pets. Question 7. Husbandry and housing. You are responsible for managing the housing of various species in a veterinary clinic. The facility houses a variety of animals, including canines, cats, and birds. What is the most important factor to consider when designing an enclosure for a new bird species that requires specific temperature and humidity conditions? A. Ensure the enclosure provides adequate space for the bird to fly freely regardless of temperature and humidity. B. Ensure the enclosure includes heat lamps and humidity control systems to replicate the bird's native environment. C. Use standard commercial cages designed for avians, assuming the species needs are similar to other birds. D. Place the bird in an outdoor aviary as exposure to natural sunlight and weather conditions is optimal. All species. Answer. B. Ensure the enclosure includes heat lamps and humidity control systems to replicate the bird's native environment. Explanation. Option B is correct because birds often have specific temperature and humidity needs depending on their species. Replicating their native environment through heat lamps and humidity controls ensures their health and well-being. Option is incorrect because while space for flight is important, it cannot replace the need for temperature and humidity control, which are crucial for the bird's survival. Option C is incorrect because commercial cages are not designed to meet the specific environmental requirements of all avian species, especially those with unique temperature and humidity needs. Option D is incorrect because outdoor aviaries may expose the bird to fluctuating and extreme temperatures and humidity levels, which can cause stress or illness. This is consistent with housing guidelines from avian care professionals and the American Association of Avian Veterinarians. Question 8. Animal behavior and communication. You are working with a dog named Bella who has recently started showing signs of separation anxiety. Bella begins barking, drooling, and urinating when left alone. Which of the following behavioral techniques is most effective for managing Bella's separation anxiety? A. Using an aversive approach, such as using shock collar to discourage barking when left alone. B. Practicing desensitization by gradually increasing the time Bella spends alone and rewarding calm behavior. C. Crating Bella for longer periods each day to help her adjust to being alone. D. Ignoring Bella's behavior entirely to prevent reinforcing anxious behaviors. Answer. B. Practicing desensitization by gradually increasing the time Bella spends alone and rewarding calm behavior. Explanation. Option B is correct because desensitization involves gradually increasing the time Bella is left alone while rewarding calm behavior. This technique helps her adjust without reinforcing anxious reactions. Option is incorrect because using a shock collar can cause additional stress and fear, potentially worsening the anxiety and behavior. Option C is incorrect because crating for long periods may increase Bella's anxiety and distress. It's essential to provide emotional support and gradual exposure rather than prolonged confinement. Option D is incorrect because ignoring Bella's anxious behavior can worsen the anxiety and prevent effective behavior modification. This approach aligns with recommendations from the American Veterinary Society of Animal Behavior. Question 9. Ethics and legal considerations. An animal care provider observes a situation where a colleague has been leaving injured animals in their cages without attending to them in a timely manner. The colleague also fails to report the injuries and there is a history of negligence. What is the most ethical course of action for the animal care provider to take? A. Confront the colleague privately and suggest they improve their care routine. B. Document the situation and report it to the proper authorities to ensure the animal's well-being. C. Wait to see if the situation improves over time before taking any action. D. Leave the facility and find a new place of employment to avoid the situation. Answer. B. Document the situation and report it to the proper authorities to ensure the animal's well-being. Explanation. Option B is correct because the ethical responsibility of an animal care provider is to protect the animals in their care. Reporting negligence ensures the safety of the animals and aligns with the legal obligations to report animal abuse or neglect. Option is incorrect because addressing the situation privately may not have the necessary impact or accountability, especially if this pattern of neglect. Option C is incorrect because waiting could result in further harm to the animals. Immediate action is needed to ensure their safety. Option D is incorrect because leaving the situation without reporting it would not address the animal's ongoing needs and potential harm. This approach complies with the legal and ethical standards set by animal welfare laws, such as the Animal Welfare Act. Question 10. Veterinary pharmacology. A 7-year-old dog named Max is diagnosed with heartworm disease and is prescribed a medication called melasomite. After a few days, Max starts showing signs of lethargy and a decreased appetite. Which of the following is the most appropriate action to take? A. Discontinue the medication and administer a corticosteroid to reduce the lethargy. B. Continue the melasomine treatment and wait for the symptoms to resolve on their own. C. Contact the veterinarian to report the symptoms and assess whether an adjustment to the treatment plan is necessary. D. Administer an anti-nausea medication to alleviate the symptoms while continuing the heartworm treatment. Answer. C. Contact the veterinarian to report the symptoms and assess whether an adjustment to the treatment plan is necessary. Explanation. Option C is correct because signs of lethargy and decreased appetite after starting a medication like melasomine could indicate an adverse reaction. It's essential to contact the veterinarian to evaluate whether the medication should be adjusted or an alternative treatment should be considered. Option is incorrect because discontinuing the medication without veterinary guidance could worsen the dog's condition. Option B is incorrect because continuing the treatment without checking for side effects may lead to further complications. Option D is incorrect because while anti-nausea medications may help symptoms, it does not address the root cause of the problem, and full evaluation from veterinarian is needed. Question 11. Exotic animal care. A pet iguana is brought into the clinic with signs of lethargy, a loss of appetite, and difficulty moving. The owner mentions that the iguana has not been provided with UVB lighting for the past few weeks. Which of the following is the most likely cause of the iguana's condition? A. Bacterial infection due to poor hygiene in the enclosure. B. Calcium deficiency caused by inadequate UVB exposure. C. Parasites due to unsanitary living conditions. D. Viral infection leading to general malaise. Answer. B. Calcium deficiency caused by inadequate UVB exposure. Explanation. Option B is correct because UVB lighting is crucial for reptiles like iguanas to synthesize vitamin D and metabolize calcium properly. A lack of UVB exposure can lead to calcium deficiency, resulting in lethargy and difficulty moving, a condition called metabolic bone disease. Option is incorrect because while poor hygiene can lead to infections, the specific symptoms in this case are more likely related to UVB deficiency rather than a bacterial infection. Option C is incorrect because parasites would typically cause gastrointestinal issues, not the symptoms of lethargy and difficulty moving. Option D is incorrect because viral infections in reptiles can cause a variety of symptoms, but calcium deficiency due to lack of UVB exposure is a more likely cause in this case. Question 12. Surgical care. A dog named Rufus is scheduled for a routine dental cleaning under general anesthesia. During the procedure, the veterinary technician notices that Rufus' heart rate has dropped significantly. What is the most appropriate action to take in this situation? A. Increase the rate of the anesthetic gas to stimulate Rufus' heart rate. B. Apply an injectable anesthetic to stabilize Rufus and raise the heart rate. C. Administer heart rate stimulants such as atropine and monitor the dog closely. D. Discontinue the anesthesia immediately and allow Rufus to recover naturally. Answer. C. Administer heart rate stimulants such as atropine and monitor the dog closely. Explanation. Option C is correct because atropine is commonly used to increase heart rate during anesthesia if bradycardia occurs. Monitoring is essential to ensure Rufus stabilizes safely. Option is incorrect because increasing the anesthetic gas could further depress the heart rate and pose additional risks. Option B is incorrect because injectable anesthetics should not be used to treat bradycardia. The goal is to manage the heart rate using appropriate stimulant drugs. Option D is incorrect because abruptly stopping anesthesia could lead to other complications and may not resolve the underlying cause of bradycardia. Question 13. Animal behavior management. A cat named Whiskers has been brought into the clinic due to increased aggression and a tendency to hide from family members. The owner reports that Whiskers was recently moved to a new home. What is the best approach for managing Whiskers' behavior? A. Immediately begin administering tranquilizers to calm the cat down and reduce aggression. B. Suggest placing Whiskers in quiet, isolated space with familiar items and giving her time to adjust to the new environment. C. Advise the owner to return Whiskers to the previous home to reduce stress. D. Introduce Whiskers to new people and environments gradually to desensitize her to changes. Answer. B suggests placing Whiskers in a quiet, isolated space with familiar items and giving her time to adjust to the new environment. Explanation. Option B is correct because cats are territorial animals and can become stressed when moved to a new environment. Providing a quiet, familiar space allows Whiskers to adjust slowly without additional stress. Option is incorrect because tranquilizers should not be used to manage aggression unless prescribed by a veterinarian. The behavior is more likely due to stress from the move, not a medical issue requiring sedation. Option C is incorrect because returning Whiskers to the previous home may not resolve the underlying issue and could further increase her stress. Option D is incorrect because while gradual introductions to new people and environments are important, forcing Whiskers into such situations prematurely can increase her anxiety. Question 14. Emergency care. A 5-year-old Labrador retriever named Daisy is brought into the emergency clinic after being hit by a car. Daisy is breathing rapidly and her heart rate is elevated. She has an open wound on her hind leg, but there is no apparent bleeding. What is the most critical first step in Daisy's care? A. Apply a bandage to the wound and monitor her heart rate. B. Administer pain relief and stabilize her leg. C. Check Daisy's airway and breathing and provide oxygen if needed. D. Move Daisy into recovery cage to allow her to rest and monitor her condition. Answer. C. Check Daisy's airway and breathing and provide oxygen if needed. Explanation. Option C is correct because in any trauma case, ensuring that the airway is clear and that the patient is breathing adequately is the most critical first step. Administering oxygen is essential if Daisy is struggling to breathe. Option is incorrect because while the wound needs attention, airway and breathing take precedence in trauma situations. Option B is incorrect because pain relief should be administered after the animal's airway and breathing is stabilized. Option D is incorrect because moving Daisy to recovery cage without first ensuring she is breathing properly and stable may lead to further complications. These questions cover a range of scenarios in veterinary care, ensuring that the answers align with common practices in the field. Question 15. Animal behavior and stress management. A dog named Bella has recently been brought to a new shelter. Since her arrival, she has shown signs of extreme stress, including barking incessantly, pacing, and avoiding human interaction. The shelter manager wants to help Bella adjust to her new environment. Which of the following strategies would be most effective in managing Bella's stress? A. Keep Bella in a separate, quiet area without any contact with other animals or people for the first few days. B. Immediately begin a training program to teach Bella basic obedience commands such as sit and stay. C. Increase Bella's exposure to other animals and people to help her become more comfortable with socialization. D. Provide Bella with calming pheromone diffuser and maintain stable routine of feeding, walks, and rest periods. Answer. D. Provide Bella with a calming pheromone diffuser and maintain a stable routine of feeding, walks, and rest periods. Explanation. Option D is correct because pheromone diffusers can help calm anxious dogs, and maintaining a stable routine will give Bella a sense of security, reducing stress. Dogs, especially in new environments, benefit from predictability. Option is incorrect because while giving Bella some time to adjust is important, isolating her too much may increase her stress levels and hinder her socialization. Option B is incorrect because beginning obedience training right away could overwhelm Bella. Training should be gradual and focusing on building her comfort first is more appropriate. Option C is incorrect because immediately increasing exposure to other animals and people can overwhelm Bella and may worsen her anxiety in the early stages. Question 16. Animal health and wellness. A cat named Felix has been diagnosed with feline hyperthyroidism. The veterinarian has recommended medication, but Felix's owner is concerned about the side effects of the medication. Which of the following is the most common side effect of the medication used to treat feline hyperthyroidism? A. Excessive drooling and nausea. B. Increased thirst and urination. C. Lethargy and weight loss. D. Decreased appetite and vomiting. Answer. B. Increased thirst and urination. Explanation. Option B is correct because the most common side effects of antithyroid medications, such as methimazole, include increased thirst and urination, polydipsia, and polyuria. These side effects are related to the alteration of thyroid hormone levels. Option is incorrect because excessive drooling and nausea are not typically associated with the medications used for hyperthyroidism. Option C is incorrect because lethargy and weight loss are symptoms of hyperthyroidism before treatment, not side effects of the medication. Option D is incorrect because A decreased appetite and vomiting are more commonly seen with an overactive thyroid rather than the medication used to treat it. Question 17. Client communication and education scenario. Jessica is a new client who recently adopted a 3-year-old dog named Max from a local shelter. She is concerned about Max's habit of chewing furniture and shoes when left alone at home. Jessica has asked for advice on how to manage this behavior. Which of the following strategies should you recommend to Jessica? A. Immediately punish Max when he chews on furniture, as this will teach him that it's wrong. B. Leave Max with an array of toys and safe chew items while she's away, and gradually increase the time he spends alone. C. Confine Max to a small room when left alone, so that he has less access to furniture and shoes. D. Adopt new dog to keep Max company while she is away, which should help alleviate his chewing behavior. Answer. B. Leave Max with an array of toys and safe chew items while she's away, and gradually increase the time he spends alone. Explanation. Option B is correct because providing appropriate toys and chew items, while also gradually increasing the time Max spends alone, helps redirect his chewing behavior in a constructive manner. Positive reinforcement and gradual changes are key in managing separation anxiety and destructive behavior. Option is incorrect because punishment, especially in the form of physical reprimands, can increase anxiety and worsen destructive behavior rather than solving the issue. Option C is incorrect because confining Max to a small room may not resolve the underlying problem. It could also increase his stress and frustration. Option D is incorrect because bringing another dog into the home may not directly address Max's chewing behavior and could lead to additional behavioral challenges such as territoriality or incompatibility between the dogs. Question 18. Animal nutrition. A rabbit named Thumper has been showing signs of lethargy and poor coat condition. The owner reports that Thumper is fed only a diet of commercial rabbit pellets. Based on this information, what nutritional deficiency is most likely contributing to Thumper's symptoms? A. Deficiency in protein and fats leading to poor coat condition. B. Deficiency in fiber leading to gastrointestinal issues and lethargy. C. Deficiency in carbohydrates causing lack of energy and fatigue. D. Deficiency in vitamins, and D. Leading to skin and coat problems. Answer. B. A deficiency in fiber leading to gastrointestinal issues and lethargy. Explanation. Option B is correct because rabbits require a high-fiber diet to maintain proper gastrointestinal health. A diet consisting mainly of pellets without enough hay or fresh vegetables can result in a lack of fiber, leading to lethargy and poor coat condition. Option is incorrect because rabbits primarily require fiber, not protein or fats, for optimal health. Protein and fat deficiencies typically manifest differently. Option C is incorrect because carbohydrates are not the primary nutritional need for rabbits. Their digestive system is designed to process fiber, not carbohydrates. Option D is incorrect because while vitamin deficiencies can affect coat health, the primary issue in this scenario is fiber deficiency, which is crucial for rabbits. Question 19. Workplace safety and professionalism. While working in an animal care facility, a veterinary technician notices that the floors are frequently wet and there is an increased risk of slipping. Which of the following actions is most important to mitigate this safety risk? A. Place warning signs around the wet area and continue working as usual. B. Immediately clean up the wet floor and ensure that the area is properly dried to prevent accidents. C. Report the issue to management but continue working without making any immediate changes. D. Avoid walking in the wet area but allow others to walk there with caution. Answer. B. Immediately clean up the wet floor and ensure that the area is properly dried to prevent accidents. Explanation. Option B is correct because ensuring a safe and dry working environment is the first step in preventing workplace accidents. Wet floors pose a significant risk of slipping, and cleaning and drying the area immediately is the best preventive action. Option is incorrect because placing warning signs is helpful but insufficient by itself. Immediate action to clean and dry the area is necessary to prevent accidents. Option C is incorrect because reporting the issue is important, but waiting for management without taking immediate action could lead to unnecessary risk. Option D is incorrect because allowing others to walk through a hazardous area without addressing the underlying risk is unsafe and irresponsible. These questions cover diverse aspects of animal care and provide in-depth analysis of the reasoning behind each answer. Question 20. Animal health and wellness. A dog named Daisy has been diagnosed with a parasitic infection and is being treated with a broad-spectrum duomer. After a few days of treatment, Daisy starts exhibiting signs of diarrhea, vomiting, and loss of appetite. Which of the following actions should be taken next? A. Immediately stop the medication and wait for the symptoms to resolve on their own. B. Contact the veterinarian to report the adverse reactions and discuss alternative treatments. C. Continue the deworming treatment without change, as these symptoms are normal side effects. D. Switch to a different brand of dewormer to see if it alleviates the symptoms. Answer: B. Contact the veterinarian to report the adverse reactions and discuss alternative treatments. Explanation: Option B is correct because Daisy is exhibiting signs that may indicate an adverse reaction to the dewormer. It's essential to report these symptoms to the veterinarian, who can assess the situation and adjust the treatment plan if needed. Option is incorrect because stopping the medication without consulting the veterinarian could worsen Daisy's condition or prevent the parasite from being fully eradicated. Option C is incorrect because while mild, gastrointestinal upset may occur with dewormers, severe symptoms such as vomiting and loss of appetite warrant veterinary evaluation. Option D is incorrect because switching medications without consulting the veterinarian may not address the root cause and could lead to further complications. Question 21. Husbandry and housing. A reptile, a bearded dragon, is being housed in an enclosure with improper temperature regulation. The temperature is too low during the day and too high during the night. Which of the following is the most critical adjustment to make to the bearded dragon's environment? A. Increase the humidity level to ensure proper shedding. B. Provide more consistent and appropriate temperature gradient with basking area at 95-105 degrees during the day and cooler area around 75 degrees at night. C. Add more substrate to the bottom of the enclosure to make the bearded dragon feel more secure. D. Provide more food to compensate for the energy lost due to temperature fluctuations. Answer: B. Provide a more consistent and appropriate temperature gradient with a basking area at 95-105 degrees during the day and cooler area around 75 degrees at night. Explanation: Option B is correct because reptiles are ectothermic, meaning they rely on external sources of heat to regulate their body temperature. Consistent temperature gradient is essential for digestion, metabolism, and overall health. The basking area is between 95-105 degrees during the day, and the cooler area should allow the bearded dragon to regulate its body temperature. Option is incorrect because while humidity is important for shedding, temperature regulation is the most critical factor in this case. Option C is incorrect because increasing substrate will not solve the problem of improper temperature regulation, which is the priority here. Option D is incorrect because providing more food will not resolve the issue of improper temperature, which directly affects the reptile's metabolism and health. Question 22. Ethics and legal considerations. A pet store employee observes a customer attempting to purchase a dog that appears to be sick. The customer does not seem concerned and is willing to pay for the dog. According to animal welfare laws, what is the employee's responsibility in this situation? A. The employee should inform the customer about the dog's condition and offer to sell them a healthier animal. B. The employee should report the incident to the store manager and take no further action. C. The employee should refuse to sell the dog to the customer and report the situation to local authorities if necessary. D. The employee should ask the customer to come back later when the dog has recovered. Answer: C. The employee should refuse to sell the dog to the customer and report the situation to local authorities if necessary. Explanation: Option C is correct because under animal welfare laws, the health and well-being of animals must be prioritized. If the dog appears sick, the employee has an ethical and legal obligation to refuse the sale and report the incident to local animal welfare authorities. Option is incorrect because simply informing the customer is not enough. The employee should not sell a sick animal and must take action to protect the animal. Option B is incorrect because while reporting to the manager is appropriate, the employee must take an active role in ensuring the animal's well-being and cannot passively allow the sale of sick animal. Option D is incorrect because delaying the sale without addressing the animal's health condition does not resolve the situation and may lead to further harm. Question 23. Specialized care. A cat named Whiskers is a senior feline with arthritis. Her owner has asked for advice on how to manage her condition, especially since Whiskers seems to be in pain during cold weather. Which of the following management strategies would be the most beneficial for Whiskers' arthritis? A. Provide warm, soft bedding area for Whiskers to rest on and consider using joint supplements with glucosamine. B. Encourage Whiskers to engage in daily exercise to improve joint flexibility and reduce stiffness. C. Increase Whiskers' food intake to help her gain weight. which can provide added cushioning to the joints. D. Avoid any handling or movement of whiskers to prevent further pain or discomfort. Answer A. Provide a warm, soft bedding area for whiskers to rest on and consider using joint supplements with glucosamine. Explanation. Option is correct because providing a warm, soft bedding area helps alleviate discomfort, especially in cold weather, and glucosamine supplements are commonly used to support joint health and manage arthritis symptoms in cats. Option B is incorrect because while gentle exercise can help, too much activity may exacerbate arthritis pain. The focus should be on managing the condition with a balanced approach. Option C is incorrect because increasing food intake to promote weight gain can actually worsen arthritis symptoms as excess weight places additional stress on the joints. Option D is incorrect because completely avoiding movement can lead to muscle atrophy and stiffness. Controlled, gentle movement is necessary to maintain joint function. Question 24. Animal nutrition. A ferret named Felix is being fed a diet of low-protein, high-carbohydrate commercial ferret food. Felix has been showing signs of lethargy and poor coat condition. What nutritional change should be made to improve Felix's health? A. Increase the carbohydrate content of his diet to give him more energy. B. Switch to diet with higher protein content and reduce the carbohydrate intake. C. Provide more fruits and vegetables to balance his diet. D. Feed Felix vegetarian diet to improve his coat and energy levels. Answer B. Switch to a diet with a higher protein content and reduce the carbohydrate intake. Explanation. Option B is correct because ferrets are obligate carnivores and require a diet high in protein and low in carbohydrates for optimal health. A diet with more protein supports energy levels and coat condition. Option is incorrect because increasing carbohydrates goes against the dietary needs of ferrets. They are not well equipped to metabolize high levels of carbohydrates. Option C is incorrect because ferrets do not require fruits and vegetables in significant amounts. Their digestive systems are adapted for a carnivorous diet. Option D is incorrect because a vegetarian diet is not suitable for ferrets as they need animal-based protein to meet their nutritional requirements. These 5 questions cover a broad range of topics from animal care and behavior to ethics, health management, and specialized care, providing a thorough examination of key concepts for advanced students preparing for the Animal Care Provider Certification exam. Question 25. Animal behavior and communication. An animal behaviorist is working with a dog that exhibits aggressive behavior when approached by strangers. The dog growls, shows its teeth, and attempts to lunge toward people who are not familiar to it was the most effective initial step in addressing this behavioral issue. A. Immediately punish the dog for its aggressive behavior to discourage future aggression. B. Gradually desensitize the dog to unfamiliar people by using positive reinforcement for calm behavior in the presence of strangers. C. Isolate the dog from all strangers to prevent further aggression. D. Encourage the dog to interact with as many strangers as possible to help it become less fearful. Answer B. Gradually desensitize the dog to unfamiliar people by using positive reinforcement for calm behavior in the presence of strangers. Explanation. Option B is correct because positive reinforcement and desensitization are key techniques in managing aggressive behavior. Gradually exposing the dog to strangers while rewarding calm behavior helps the dog associate unfamiliar people with positive experiences, reducing fear-based aggression. Option is incorrect because punishment could worsen fear and aggression, leading to increased anxiety in the dog. Option C is incorrect because isolating the dog can reinforce its fear and prevent it from learning how to cope with strangers in a healthy manner. Option D is incorrect because overwhelming the dog with too many strangers at once may increase its anxiety and aggression rather than helping it adjust to new people. Question 26. Animal nutrition. A veterinarian is treating a puppy with a food allergy. The puppy has been itching and scratching excessively, and the vet suspects that a protein in its current food is the cause of the reaction. What dietary change should be made to address the food allergy? A. Switch the puppy to a diet with a novel protein source that it has not been exposed to before, such as venison or duck. B. Increase the amount of protein in the puppy's diet to help its immune system respond better to allergens. C. Add more carbohydrates to the puppy's diet to dilute the potential allergens. D. Continue feeding the puppy the same food but add supplements to strengthen its immune system. Answer A. Switch the puppy to a diet with a novel protein source that it has not been exposed to before, such as venison or duck. Explanation. Option is correct because switching to a novel protein source is often the most effective way to manage food allergies in pets. This helps avoid the allergens causing the reaction. Option B is incorrect because increasing protein in the diet will not address the allergy and may worsen the condition by providing more of the protein the puppy is allergic to. Option C is incorrect because increasing carbohydrates does not address the food allergy and may not be beneficial in treating the underlying issue. Option D is incorrect because simply adding supplements will not resolve the food allergy. The protein source in the diet must be changed to eliminate the allergen. Question 27. Specialized care. A 10-year-old dog, Max, has been diagnosed with diabetes and is being treated with insulin injections. Max's owner has noticed that he seems to be more lethargic and is drinking more water than usual. What is the most likely cause of Max's symptoms and what action should the owner take? A. The symptoms are likely due to the dog's age and natural decline in energy levels, and no immediate action is required. B. Max's insulin dosage may need to be adjusted. The owner should contact the veterinarian to discuss his symptoms. C. The symptoms suggest that Max is dehydrated. The owner should increase his water intake and monitor his condition. D. Max is likely developing secondary infection and the owner should administer antibiotics immediately. Answer. B. Max's insulin dosage may need to be adjusted. The owner should contact the veterinarian to discuss his symptoms. Explanation. Option B is correct because increased thirst and lethargy can be signs that Max's blood sugar levels are not well controlled, potentially indicating the need for dosage adjustment. The veterinarian should be contacted for professional evaluation and to determine the appropriate insulin levels. Option is incorrect because these symptoms are more likely related to the diabetes management rather than the dog's age alone. The owner's observations should not be dismissed. Option C is incorrect because while dehydration is concerned, increased thirst is more directly associated with fluctuations in blood sugar rather than simple dehydration. Option D is incorrect because there is no evidence to suggest secondary infection. The symptoms are more indicative of diabetic issues. Antibiotics would not address the underlying cause. Question 28. Animal health and wellness. A kitten has been found with a severe flea infestation. The kitten is scratching intensely and the owner is concerned about the potential for flea-related diseases. What is the best course of action for treating this infestation? A. Apply a topical flea treatment and give the kitten a bath to remove as many fleas as possible. B. Give the kitten a flea collar and wait for it to self-treat. C. Apply a safe vet-recommended flea treatment appropriate for kittens and treat the environment simultaneously to eliminate fleas. D. Use a generic flea treatment from a pet store without consulting a veterinarian to avoid unnecessary expenses. Answer. C. Apply a safe vet-recommended flea treatment appropriate for kittens and treat the environment simultaneously to eliminate fleas. Explanation. Option C is correct because treating both the kitten and its environment is essential to completely eliminate fleas. Kittens should only receive flea treatments that are specifically designed for their age and weight to ensure safety. The environment should also be treated to prevent reinfestation. Option is incorrect because while bathing can help remove some fleas, it is not sufficient for a severe infestation and may not address the root cause. Flea treatments should be administered as part of a comprehensive plan. Option B is incorrect because flea collars are not always effective for severe infestations and may not be suitable for kittens. Moreover, they should not be relied upon as the sole treatment. Option D is incorrect because using generic treatments without veterinarian guidance could be harmful to the kitten, especially since some flea treatments are toxic to young animals. Question 29. Client communication and education. A new pet owner has adopted a rescue dog that is displaying signs of anxiety, such as barking excessively when left alone and chewing on furniture. The owner is seeking advice on how to address the behavior. Which of the following suggestions would be most helpful for the owner? A. Recommend using a strong anti-anxiety medication immediately to control the behavior. B. Advise the owner to train the dog gradually and provide positive reinforcement for calm behavior when left alone. C. Suggest that the dog be left alone for longer periods each day to help it become less anxious. D. Recommend returning the dog to the shelter because the behavior is likely to worsen over time. Answer. B. Advise the owner to train the dog gradually and provide positive reinforcement for calm behavior when left alone. Explanation. Option B is correct because crate training, when done gradually and paired with positive reinforcement for calm behavior, can help the dog feel more secure and reduce anxiety. This method addresses the root cause of the behavior while building trust between the dog and owner. Option is incorrect because medication should not be the first approach. Behavioral training techniques should be prioritized and medication should only be considered if behavioral strategies are not effective. Option C is incorrect because leaving the dog alone for longer periods can increase anxiety and worsen the behavior rather than helping the dog. Option D is incorrect because returning the dog to the shelter should not be the first solution. Many behavioral issues can be managed with appropriate training and patience. Question 30. Ethics and legal considerations. A veterinarian is aware that a colleague has been administering unnecessary treatments to animals to increase profits. The animals are not harmed, but the treatments are costly and not required for the animal's health. What should the veterinarian do? A. Ignore the situation as it does not directly harm the animals. B. Confront the colleague privately and ask them to stop administering unnecessary treatments. C. Report the unethical behavior to the relevant veterinary licensing authority or animal welfare organization. D. Discuss the situation with the pet owners and let them decide if they want to report the behavior. Answer. C. Report the unethical behavior to the relevant veterinary licensing authority or animal welfare organization. Explanation. Option C is correct because the veterinarian has an ethical and legal obligation to report any unethical practices, even if the animals are not directly harmed. Reporting the situation helps protect the animals and maintains the integrity of the profession. Option is incorrect because ignoring unethical behavior is not an acceptable course of action, even if the animals do not seem to be harmed. Option B is incorrect because while confronting the colleague may be a valid approach, the situation should also be reported to the appropriate authorities to ensure that it is addressed properly. Option D is incorrect because it is the veterinarian's responsibility to take action, not to place the burden on the pet owners to report the behavior.